Many people are very concerned about the state of our healthcare these days. Going to the doctor feels like a fractured experience, and you know something is missing, and often your doctor does too. This is our 360 Medicine Clinic office. We're located in Santa Fe, New Mexico. This is where I see patients and where we do a variety of different medical treatments. I'd like to show you inside. The current medical model, I think, is also biomedically dangerous and not sophisticated enough, where health is just seen as only the absence of disease. On a bigger picture, I think our healthcare model is socially unsustainable. It's economically a disaster. And continuing with our current medical system, I think, is culturally irresponsible. I'd like to show you another way. My name's Dr. Russ Canfield. I'm a board-certified family physician. I'm also board-certified in integrative holistic medicine. Welcome to my clinic. I'd like to show you around. I remember writing my application for medical school and writing about how it was important to me to practice both the art and the science of medicine. I'm really a generalist at heart, and I really like to look at the big picture. I like to look at the picture from 30,000 feet and look at it from different perspectives, and that's what we do here. When I say that medicine is fractured, here's another way to see what I mean. 21st century integrated medicine recognizes that health is much more than just the absence of observable disease. We talk about on our website a deeper definition of health, where health and well-being is a function of a person's aliveness within 4 essential domains or quadrants, as well as on all levels of our being and in all of our functional capacities. But let's look at the standard allopathic Western model for a moment. It's technically very sophisticated. There are large academic centers and there are sophisticated diagnostic tools that are used. But conventional medicine tends to reduce you down to your objective data, your blood pressure, your weight, your cholesterol levels. But your internal experiences, your thoughts and your emotions, your intuitions aren't always appreciated as being as real to their corresponding hormone level or neurotransmitter level or the liver enzymes. In other words, I think you're constantly needing to translate every experience that you have into the doctor's materialistic terms. So one of the things that 360 means to me is a strong doctor-patient relationship, as well as, I think, more extensive knowledge about wellness. We need a rescue plan. Pharmaceutical costs are rising. Costs of MRIs and other imaging tests are rising at an alarming rate, just when the baby boomers want more health care and Medicare rolls are going to be increasing. We desperately need to change the way that we think about health and medicine and really honor some of these underlying levels. Many of the home foreclosures are a result of people having to deal with astronomical medical bills that could potentially have been prevented had they had a physician that was really able to work with them rather than just resorting to pharmaceuticals. We really need an economically sustainable as well as an environmentally green medicine. There are trace amounts of an entire array of pharmaceuticals in our rivers and streams in this country, causing who knows what type of downstream medical problems. We know that adverse drug reactions from properly prescribed and properly administered drugs represent the 4th leading cause of death in this country. And this is reported in mainstream medical journals like the Journal of the American Medical Association. Our healthcare system is culturally irresponsible. we can see this crisis coming and we need to make the right choices to get us out of this mess before it's too late. Our medical model that's based on prescription drugs is short-sighted. These prescriptions, they're very powerful, but what they do, they block the functions of very specific enzymes, or they attach to very tightly to very specific receptors on cells, so that they have very potent but specific downstream functions. To contrast, many natural medicines or herbs will bind very gently to a vast array of different cell types, and the functions that they can provide are more gentle, with less side effects, and more regulatory, and help us to adapt, rather than a drug that has a one-size-fits-all, very significant effects with significant side effects. As a family physician that coordinates overall medical care, I strive to see the largest whole to better guide my clients' overall medical care. We talked about how I think we can see your underlying biological uniqueness with a more sophisticated eye than standard medicine, and also appreciate the felt dimensions of what you're going through, and resonate with what your concerns and goals are, and work together. But also we can look at your situation from a perspective of the collective level, and the dimension of relationships and family and your work situation, and how that may also play an important role in your overall health. If this style of medicine and our way of looking at health and healing is appealing to you, check us out. Our website is 360medicine.com. I'm also a very active affiliate of the Santa Fe Soul Health and Healing Center, and I'm really a team player. I enjoy working with complementary and alternative practitioners. I feel that we all are partially right, and often when the group of us works together, we can create an even more complete picture of health and wellness.